For my IRI assessment and intervention plan, I focused on a first grade girl. Her name is Gabby, name changed for privacy. She is a student that I'm very familiar with. I was her teacher when she was in pre-K. And I have a very close relationship with her mom, so I am very in tune with her strengths and her needs as a student. She is a gifted and talented student. Like I said, she's in first grade. She excels in math and science, the more literal subjects. But she does struggle with literacy, both with reading comprehension and with the decoding of words and her phonemic awareness. So I felt that she was an excellent candidate to administer this test, and I also thought it would provide her parents with some insight as to where she stands in terms of her literacy needs and maybe uncover some things that her current teachers have not quite uncovered yet due to the constraints of their classrooms and having about 25 kids in the room. I started at the pre-primer level with the word administration lists that were provided in our textbook. After advancing through the pre-primer and the primer level, when she scored 85% on the first B level, that was an indication for me where to start with the oral reading. Just a quick review of Gabby's oral reading results. She tested at the primer A level for her independent level, the first B for her instructional level, and the 2-1C was her frustrational level in the oral comprehension portion of the IRI assessment. Her results were the same for her listening capacity test. For the instructional level, she read 83 out of 88 words correctly, and for the frustrational level, she read 96 out of 112 words correctly. She did answer the questions, but again, her comprehension was somewhere in the middle on all of those levels. She was able to answer the literal questions much easier than the inferential questions. The silent reading IRI was a bit more of a struggle for Gabby. She tested at the pre-primer level for her independent instruction, the primer A for her instructional level, and first B for her frustrational level, which was a level below in each category, which was below her grade level for average in all of these levels, which I found interesting considering she is a gifted and talented student, which only makes the case for differentiated instruction. Just because she's gifted and talented does not mean that she doesn't have needs that need to be addressed. Overall, I noticed that she was, like I said, stronger in her literal questions as opposed to the inferential questions. In terms of the actual administration of the IRI, she used her finger as a placeholder when reading and struggled with blending individual phonemes. I believe that her difficulties in blending these phonemes and isolating each sound as opposed to sound phonograms prevented her from thoroughly reading for comprehension purposes. She would get stuck on certain words, which prevented her from gaining any meaning from what she was reading in the passages. Her IRI results revealed two areas of need. Her first area of need being phonemic awareness, and which led to her second need of reading comprehension. When I closely examined her miscues, I noticed that she was struggling with words like door and words like pour. She wasn't reading the phonogram of the OO as a unit of sound. Rather, she was trying to sound out each O individually, which wasn't giving her the results that she needed. My intervention program would address both of these issues. One would start with the whole word recognition skills through decoding phonograms and studying word families so she could become more familiar with the vowel-vowel, vowel-consonant, and consonant-consonant phonograms, followed by close comprehension, coaching, and instruction. The first step in my intervention program would focus on the decoding of phonograms. Research suggests that English does follow typical patterns as our textbook said, I would not teach her rules associated with these patterns because rules do not always necessarily apply. However, I would use them as suggested guidelines. I would start with using a magnetic board with tiles. We would work on first vowel-vowel phonograms, then advance to vowel-consonant phonograms, followed by consonant-consonant phonograms. Research says that that would be the best way to begin, as the vowel sounds produce more. So with these magnetic board tiles, I would give her a vowel family to start with, and then she could fill in the words as needed. She could create words that are familiar to her. I could give her a suggested word list, and we would go from there. Before moving from vowel-vowel to vowel-consonant and finally to consonant-consonant, I would administer word tests between each level to ensure that she was ready to move on. Once I see that she is grasping this idea, I would administer oral reading passages that contain these phonograms. I would show her flashcards prior to the oral reading passages so she was more familiar with the words. Gabby, in terms of her social emotional development, does struggle with perfection. She doesn't like to make mistakes. She always likes to be right, which can sometimes prevent her from successfully reading oral passages or silent reading passages, because as soon as she is unable to read one word, she loses her train of thought. So the flashcards before the oral reading passages would help her become familiar with the words that she may encounter so that she could read more fluently. I would keep a running record of her progress, which would help me indicate when she is ready to move on to the comprehension level of the intervention strategy. Once she is ready to move on to the comprehension strategy, I would ask her to read passages that contain words of the word families, the word families we've been studying, whether we're focusing on the vowel-vowel, the vowel-consonant, or the consonant-consonant, or all three, a mixture of each. Before I would ask her any comprehension, literal, or inferential questions, I would allow her to just tell me about what she read, discuss it in her own words, which definitely reinforces the comprehension and the ideas that she may have come across in the passage, but it lets it put her into her own words in a more comfortable, familiarized way. To help her with her cause and effect, her sequence, which will always help answer those inferential and literal questions, I would introduce her to the idea of a graphic organizer where she could visually lay out her information in a way that will help with her comprehension. Like I said, she is very strong in mathematics and science. Those are very visual concepts. She needs that visual portion, that visual support to help her with her comprehension needs. I would consistently review my intervention program, assess her, continue to administer IRIs to see how she's doing. I would have a constant open lines of communication with her parents and just to walk them through our intervention program, keep them abreast of the situations and how that they can best help, especially with the flashcards, having her read a little bit each night as long as she's not too tired, and move on from there. And thank you for watching.